Okay, so this lecture is on chapter 42, the physician's office laboratory. This is the first installment in the specimen collection and blood specimen collection unit that we're going to be going through, phlebotomy, urinalysis, all of that. Before we can do any of those things, though, we need to learn about the office environment in terms of the laboratory itself. And the first thing we're going to talk about is evaluating the environment. Every office has its own kind of expectations on safety. And one of the great things about the healthcare industry is that we like to make lists. So the first thing that you would have is a checklist that you would use to perform safety inspections with regard to, like, in accordance with how the facility wants you to perform them. So Ohio Health's safety inspection checklists might be a little bit different than Avita's. Every facility has their own regulations. And then they also have the same regulations through the state. Always prepare a report on your findings. If something's abnormal, you need to document. You want to verify that safety needles are used and properly disposed of. When we get into phlebotomy, I will teach you what a safety needle is and how it differs from the olden days when we used to just have needles that didn't have any safety device on them. So basically, a safety needle has a clasp on it that you push up to dull the edge of the needle so that it doesn't, you can't stick yourself with it. It closes the needle off. That's what that's referring to. This talks about identifying safety techniques that can be used in responding to accidental exposure to blood, other bodily fluids, and chemicals. In infection control last year, we talked about what to do. Like if you get something in your eye, you want to flush it out with sterile water. If you spill blood, there's different protocol for how to clean that up. Where to put things that are bloody, biohazardous bags. We talked about all that last year, and that's kind of with regard to that. There are different safety techniques, though, for chemicals, and there's different ways to store different types of chemicals. So, in the physician's office laboratory, you need to always be alert and conscientious. This means that if it seems out of place, it probably is. Like, you look at the same four walls every day, and eventually you stop noticing the things on the walls. You get comfortable with it. You get acclimated. It becomes your surroundings. In a medical office laboratory, you can't do that. You can't get comfortable. You have to stay alert in case something changes. If something seems abnormal, in the mundane, it probably is. You always want to practice standard precautions. Universal precautions. We learned about those in infection control as well. Hand washing is critical. Thanks to COVID, I think that's even more noticeable now than it ever was. But, you want to wash your hands for at least 20 seconds in between every patient, in between any lab testing that you're doing, in between any handling of any specimens, etc. Comply with standards and guidelines set by regulatory bodies. That could be the FDA, the CDC, those are regulatory bodies. And then focus on accuracy and efficiency of procedures and charting of information. The worst thing you can do in healthcare is get too comfortable. And what I mean by that is, once you get comfortable with your job, that's great because you know what you're doing, but the more mundane it becomes and the more frequently you're doing the same thing over and over again, you get so comfortable with it that you get careless. You can't afford to get careless in this industry. That's when you hurt people, right? So we really want to make sure that we are constantly on our game and don't get too comfortable. So you always want to have protective barriers on your body. Give me an example of a protective barrier. Gloves. What else? Goggles. Gowns. Yeah, very good. That's appropriate attire. You want to have your immunizations up to date. Why do you think that's important? So you stay healthy so that if you're exposed to something and it has hepatitis B in it, guess what? Your immunization for hepatitis B is up to date. You're good to go. Yes. Yeah.
What do you think in say 5, 10 years from now when we're working in that, what kind of diseases are going to be out there?
That's a really good question, and I don't have an answer for you because that stuff changes. It used to be that polio was really big and smallpox were really big, and so you had to get the vaccination for those. Now we have the flu vaccine, hepatitis B vaccines, diphtheria, titers, stuff like that. Those will always exist in some way or another. But that doesn't mean that there won't be some new disease that we have to vaccinate ourselves against, COVID being one. COVID vaccines will be probably required for healthcare professionals at some point. I don't know when, and I don't know how. Like, I'm not sure how that works, but yeah, that's a really good question. Those are things that are going to come into play as time moves forward. Federal and state regulations impact the medical office and safety. You have to follow the guidelines set in place by the government in order for the physician's office to be compliant and that physician to be able to maintain that practice. OSHA, Occupational Safety Health Administration, pretty straightforward. They make rules that say you can't climb on a ladder that's over so many feet, or you can't store bodily fluids in a certain area. They give you rules for all occupations. The global harmonized systems, I've got to be honest, I'm not familiar with. I've been in healthcare for like, I don't even know how many years, and I've never encountered anything that was global harmonized. I imagine it's something along the lines of OSHA, but it's probably just on a global scale. I encourage you, if you want to know more about that, to research that on your own time. Safety data sheets, they used to be called material safety data sheets. Now they're just called safety data sheets. These are what we store chemical information on. So you work in an office and everything has a chemical in it. For instance, the ink in your pens has a chemical in it, right? You have to have a safety data sheet on the ink in that pen. So every item in the entire world, well, United States, has a material safety data sheet that goes with it. So your bleach cleaner that you have, there's a safety data sheet. Like I said, your pens, your ink for your tone, like your toner ink for your printers, any cleaning supplies, any medications, anything that you can be exposed to that could potentially hurt you has a safety data sheet. The safety data sheet includes what is in the item, the content of the chemical, and then what to do in the event that you get exposed to it and it causes you a problem. Okay, that's what those safety data sheets are for. Does that make sense? You will always find them in bright yellow binders with like the words SDS written in bright red or black ink. And they should always be visible next to an eye wash station, next to like a lab. You always want to have those hanging on the wall so you can see those, that you know that if you get exposed to a chemical, you can flip to a certain page and the information on how to save your life from that chemical is right there, okay? Safety signs, symbols, and labels. In your textbook on table 42-1, there is a whole table explaining to you the safety signs, symbols, and labels. Familiarize yourself with these. Most of them are pretty straightforward, but just be aware that you may encounter some of these, especially those of you that are going into a different type of medicine. Maybe you're not going into work in an office and you're really interested in doing like something with the chemistry side of medications or, medicine in some general form. And you're dealing with substances that might be dangerous. This is something that you'll really run into a lot. The CDC is the Center for Disease Control. Due to COVID, I think we're all more familiar with what the CDC is than we ever would have been. They make all the rules and guidelines with regard to public health. So public health is what I refer to as like your communicable diseases. So something that would run through the health department is ordained by the CDC. They are the ones that determine which strain of the flu is going to be most predominant that year in terms of which strain we vaccinate against. They're the ones that run or that not notify you when there's like a pandemic or an outbreak of a disease in a certain area and what to do, et cetera, et cetera. And then there's the CLIA. The CLIA is the Clinical Laboratory Improvement Act. This is something that you're going to become very familiar with as we move through phlebotomy, because they're the ones that really determine like your chain of custody, like how we report results. They're the ones that determine how we run results, what testing is what. There's forms, specific forms for the CLIA that you're going to work with as well. Fire regulations. Nobody thinks about this, but if you work in a hospital-owned medical office or any medical office, you have to go through fire training. So you have to learn what to do in the event of a fire, right? So we know here at Pioneer, we have to leave, we have to go downstairs, we have to go outside if there's a fire drill or if there's a fire alarm. In a medical office, you have to be trained on how to use the fire extinguisher, how to check the fire extinguishers to make sure that they're up to date. And then you also will have the fire marshal from the fire department come in and verify that you guys are up to code so that there are no safety fire hazards in the medical office. These are all responsibilities that you're going to have. Working in a hospital is no different. If you work in a hospital and the chief of the fire department comes in to do your inspection, if you have one of those, let's say you work at an office at a hospital, you're just sitting there, you're typing, you work at a desk, but your feet are always cold and you have one of those heaters, those little floor heaters, you know what I'm talking about, that they plug in. Those are safety fire hazards. So they actually will make you unplug those and you'll get cited by the fire marshal for having that piece of equipment that could cause a fire hazard. So all those things are really important. Then you have the PASS, which is, I believe, forgive me if I'm mistaken, pull, aim, sweep, or spray, sweep, I believe is the acronym. I believe it's spray and then sweep, because sweep and then spray would be backwards. So yeah, it's pull, aim, spray, sweep. This is the way you handle a fire extinguisher. You pull the pin, you aim, you spray, and then you sweep, okay? This is something that you'll learn also through training in the future. Clean spills and dropped objects. Certain spills require certain care. For instance, blood has to be dealt with differently than vomit. Okay. Both of them are bodily fluids though, right? Both of them could potentially contain a disease that could hurt lots of people, but they are dealt with differently. Personal safety, we wear our PPE. We follow guidelines put in place by OSHA, by the CDC, by the CLIA to protect ourselves. And then infection control. So last year we spent a lot of time on chapter 34 and infection control. I encourage you to review this chapter on your own just to refresh your memory though, because it is valuable information, okay? It absolutely is valuable information. It is the most important thing that you need to be aware of is how to break the chain of infection. We know that we can break the chain of infection by washing our hands, by sterilizing, disinfecting, or sanitizing instruments appropriately, by wearing PPE, by following guidelines, etc. Any questions thus far? Okay, so there are several lab classifications. There's lots of different government agencies that are involved in the promotion of safety and security in healthcare. So like I told you, the Clinical Laboratory Improvement Act is a company or is a branch that works to make the clinical lab a safer place and tests ran more accurately and more efficiently. The CMS is the Center for Medicare Services. And then OSHA is the Occupational Safety Health Administration. All three of those absolutely dictate how things are done in a medical environment. So we will learn a lot about those as we move through the chapter itself. And if you have any questions, I encourage you to refer to chapter 42 in your textbook for more information on those three different branches, or government agencies rather. So the complexity of lab tests performed determines the classification. So what that means is however complex the test is determines what category it falls under. So the different categories of testing are waived, and then moderately complex, and then highly complex. Waived means that there is no CLIA needed, so it's called a CLIA waiver. This is like pretty standard testing, like a regular lipid screening or a glucose screening or something pretty routine. Moderately complex, they need microscopes to do the testing. That would be a PPMP. and then a highly complex, that's a different form of testing as well. Okay, so quality assurance. How many of you have worked in a factory or know what factory work is like? None of you? Okay, so every time a factory makes a part, somebody comes through and does a quality check to make sure that the part is correct, right? Healthcare's got that same system involved. It's just a different type of quality assurance. So it refers to all evaluative services and the results compared with accepted standards. Quality assurance involves proper patient identification. Why do we need to know who our patient is? Why is that important? Correct. We want to make sure it's the right patient. Patient preparation and specimen collection. Part of the preparation part is what? Getting consent, right? We need to get consent. That is really important. Okay, and to collect a specimen, you have to get consent from your patient. That's part of the preparation process, but also part of the preparation process would be telling them how to give you the specimen. If it's a urinalysis, you need to explain to them how you want them to collect the urine. And then there's the testing and, the processing and transportation process for a specimen. Obviously, if you have a urine specimen, there needs to be something in place that tells you how to transport said urine to the location in which it will end up. Instrumental and technical performance. These are all parts of quality assurance. So instrumental and technical performance. Is the equipment calibrated? Are the machines running? Is everything in proper working order so that we can efficiently run the test result and get an accurate result? Safety. These machines that run these tests and stuff can be really heavy. They can break. They could be considered harmful. They could spray dangerous chemicals places. It's just really important that you're always ensuring safety and that your machines are functioning properly and that the lab is a safe place to work. And then also there's always in-service training and education for all healthcare personnel. Let me tell you, in healthcare, you think that once you graduate from school and you've got your certification or your license that you don't learn anymore? No. There are yearly in-services that you're required to attend. If your hospital or your facility implements anything new, there's an in-service that comes with it. It is a literal, non-stop, always learning job. So also for quality control, a process of assessing testing procedures, reagents, technique of individual performing tests. So that's kind of what I just talked about, making sure that your equipment is functioning properly so that you can get the accurate results. And then there's the use of test kit controls, which like value range of control, and then the reagent strip test. One thing that we do with urinalysis is a reagent strip, so I'll teach you more about that when we get into that activity in next chapter. Then there's the microscope. I unfortunately don't have one of these, but this is a really great way to look and see what cannot be seen with our naked eye. Because blood is red. Like we see blood, it looks red, correct? But there are millions of little microscopic components to that blood that we can't see with our eyes, so we need to enhance it with a microscope so that we can visualize it, see if the cells are correct, see if there's bacteria floating around, etc. The microscope must be handled with care. Typically, we don't transport microscopes. They stay in one location in a medical facility. But if you have to transport a microscope, you need to carry it with one hand under the base and the other one on the arm so that you don't drop it. It doesn't fall apart in the transportation process. And you always want to make sure that those are calibrated and that they're well maintained. Parts of the microscope, you have the arm and then the eyepieces. I'm actually not going to go deeply into this. I'm just going to kind of touch base on it a little bit so you're familiar. Eyepieces, there's two different kinds. There's binocular and monocular. This is pretty standard. The monocular is just one piece. You put your eye on it, you use one eye, you look into it. And then there's the binocular where you put both eyes on. Again, I'm not going into high power field, low power field, oral immersion. I don't teach how to use a microscope. This is something that you would learn as a lab technician. But just be aware that this information is here in this presentation for you. And that is it. Does anybody have any questions?